Are your eyes bothering you? Not just the occasional dryness or redness, but regular discomfort and irritation that can get in the way of living your normal life? You may have meibomian gland dysfunction, or evaporative dry eye. Think about the treatments you've tried in the past to get some relief, and think about the compromises you have to make every day and the lifestyle issues you face. Maybe it's not wearing contact lenses or limiting your computer time. Even just reading a book or enjoying a breezy spring day may be out of the question. Any of this sound familiar? If so, you should know that eye experts have recently made great strides in understanding evaporative dry eye. And with the introduction of the breakthrough technology in the Lipiflow system, it may be possible to make the discomfort, inconvenience, and limitations of evaporative dry eye a thing of the past. Your tears are made up of 3 layers: the mucin layer that adheres to the eye, the aqueous or water layer, and the lipid or oil layer, which lubricates and prevents evaporation. Until now, much of the focus of dry eye treatment has been on supplementing the tear film with the use of drops and ointments. However, 65% of patients with dry eye symptoms actually suffer from evaporative dry eye. The lipid layer is created by meibomian glands in the eyelid. When you blink, pressure is put on the glands and lipids are released. Evaporative dry eye disease is most often caused by a blockage or obstruction in these glands, called meibomian gland dysfunction, which can lead to a lipid deficiency in the tears and cause symptoms such as watering, gritty feeling in the eyes, and itching. To treat the blocked glands, your physician may have directed you to apply heat near the meibomian gland by using warm compresses on your eyelids. However, the tarsal plate, a layer of cartilage that provides natural protection around the eye, prevents this heat from effectively reaching the gland. With the breakthrough Lipiflow system, your doctor now has a new way to treat meibomian gland dysfunction or evaporative dry eye. And if your doctor determines that you are a good candidate for Lipiflow treatment, he or she can take advantage of this technology to treat you right in his or her office. Unlike warm compresses, the Lipiflow system applies a combination of heat from the inside of the lid near the meibomian glands and gentle pressure on the outside of the lid designed to liquefy blockages in the glands.
Lipiflow is entirely different from any other treatment we've had before for meibomian gland disease because it gives exactly the treatment that's needed right where it's needed. We take heat and we put pressure directly on the meibomian glands to express those glands and to remove the inspissated secretions that are blocking the flow, and it restores natural flow in a very natural way.
What we're achieving with the Lipiflow is applying the heat very precisely to that area that needs it the most.
On average, Lipiflow patients had a statistically significant improvement in their symptoms.
It was horribly uncomfortable, a feeling like my eyes were scratched. I couldn't wear my contacts much. I was continually putting drops in. I just had so many problems with my eyes, it was brutal. It's made a huge difference. I now only use drops once in a blue moon. I can wear my contacts. It's very exciting. This has made a huge, huge difference.
By the end of the day wearing contact lenses, my eyes were uncomfortable. Pretty much every evening I used some kind of eye drop to ease the burning and discomfort. After the treatment, I realized I hadn't needed to put eye drops in at the end of the day.
And we finally have a treatment that can be done as an outpatient in the physician's office, delivered by the physician and their assistants, to give patients a meaningful improvement in their disease.
In a clinical study at 4 weeks after treatment, 79% of patients reported improvement in dry eye symptoms. To determine if you are a candidate for the Lipiflow treatment, your doctor will examine the meibomian gland openings in your eyelids.
The LipiView allows us to document over time an evaluation of the tear film.
The Lipiview takes approximately 20 seconds of video of your eye during a non-invasive in-office exam that lasts less than 5 minutes.
This is really a new step in the direction of assessing the quality of someone's tears before the damage is done.
With the introduction of Lipiflow technology, effective treatment of evaporative dry eye is possible.
This treatment is going to revolutionize the management of these patients. Patients that really are quite desperate from a process that has developed over the past several decades, where we just really have not had effective treatment to offer them until now.
Talk to your doctor about your symptoms and ask for a Lipiflow brochure. It could be the first step on your journey toward breakthrough relief.